There are 33 million people living with HIV worldwide. The majority of them do not know they are positive. How can we possibly stop AIDS if we don't change that? We need to think bigger. We need to be testing 1 billion people. And so AIDS Healthcare Foundation started that process by launching the Testing Millions campaign. We're a full-service organization operating in 22 countries. We have 1,000 employees. We have 130,000 patients that we care for. We've gone from being a local grassroots group to being a national organization, to being a global organization, and now being the largest AIDS organization in the world. India is a big concern. It has the second largest number of positive people in the world, yet testing is very difficult for the average person to access. The system by which people were being tested was so antiquated that we knew that we couldn't do it that way. They were taking a half hour for each person, and if we need to do 1 billion tests, that's 500 million staff hours. That's not practical. We felt that we had to have a big demonstration of the capability to test people. And that's why we came up with this idea of the Test Millions campaign. When I see women lined up in saris in India, waiting to be tested, it tells me that the people are ahead of the policymakers. People want to be tested.
All right, 2.5 weeks out.
Yeah, I'll be here before we know it.
Yeah. Remember, I leave for Africa on the 22nd, so I'm here all next week. And then you guys are in Command Central here, okay? This year, AHF testing has significantly increased from last year. So now the priority is that we need to get the test kits to our sites to get that 500,000 done. We've learned a lot this year. I think we could write a book on getting condoms around the world. And it would be a lot of lessons learned in the chapters.
Taxi operators, they are the kind of people who really didn't want to test HIV/AIDS. Taxis are more than 30,000 taxis because it is the most cheap, convenient transportation system we have in Uganda. Uganda Cares has done a great job. We are moving taxi by taxi, talking to them, encouraging to go and test for HIV/AIDS. We go. Come on, we go. He has the fear to go and test and tell them to show you where Uganda Cares is. Then you tell them, I want to test my blood. I want to know my HIV/AIDS status. Tosobola kuva kubya sex no banga neweekuma. Can't you abstain? He's saying he cannot abstain, but he can use condoms. But he can't abstain. That's what he's saying.
We have to take the stigma away from condoms, and we have to market them the way we would Coca-Cola. That's why we've come up with our Love Condom. The message, love yourself, love your partner, is a universal one.
We have seen in Uganda now services for testing being taken to where the people are, in marketplaces, at bus stops, at railway stations, and those people then are able to have the testing done on site. I think it's very important to have mass testing initiatives in collaboration with an institution like AIDS Healthcare Foundation. The testing methods have changed where you get the quick tests, where within a minute one is able to get the results. We have seen a revolution where there is mass testing and you can have in one day thousands of people testing.
The real challenge, if we want to stop this disease, is to find the people who are positive and break the chain of infection and get them into care. The magic ingredient is hope. People know that there's hope, and therefore, if they're positive, they know that they can get treated and they can live a relatively normal life.
Eastern Europe is facing a critical phase of HIV/AIDS epidemic because it is the fastest growing epidemic in the world. But what makes the epidemic unique is really the speed. For example, in the last 7 years, the number of people officially registered in the region grow more than 65%. And this really makes epidemic in the region unique and really in crisis.
My name is Kate. I'm 27 years old. I'm project manager and I work in AIDS service organization. Yes, I'm HIV positive woman. I got my test when I was 18 years old. It was my first test and it was positive. When I told my parents that I'm HIV positive, because mother was crying, father was shocked. Now I'm pregnant. My baby will be born in a month, in the beginning of New Year. So now I take my pills every day, and this is a prophylaxis for my baby not to be infected. If I will follow all instructions during my pregnancy, my baby will be healthy.
The Testing Million event in Tallinn was truly revolutionary. Everybody who wants to get free and easy HIV test and learn their HIV status. People stood in the wind and freezing rain for more than an hour. It was really a celebration of free spirit and united efforts in this Baltic nation.
I thought that I knew what will happen, and it was really nice to see only one dot in there, which means negative. So it was very nice.
After the campaign, people were continuing to call to find out when again they can get HIV test.
Many countries have seen the impact of AIDS and realize it's something that does have to be dealt with, even if they don't like talking about it or thinking about it. We're normalizing it. We're helping to reduce the stigma. We're saying it's not such a hush-hush thing. You get screened for other diseases. This is something you need to do. Get it done quickly, no muss, no fuss. And if you are positive, you will have immediate access to treatment. We couldn't have done this testing campaign 10 years ago because there was no treatment available.
I was born here in Francisco, Sarabia.
Aquí me crecí.
I was raised here, and as I got older, I played with my friends.
Jugaba yo con mis amigos.
And that's where I met Apolonio. I thought with my husband I will not suffer because he would give me what I want. He started to get sick. He got headache, stomachache, and nausea. He went and had the HIV test done, and it did come out positive. When he told me, I thought I was going to faint. I couldn't believe he has that illness. I did not believe it. My kids are going to die, I told him. He stopped taking his medications. He started to get sick. I took the test. It came back positive, the test that they did. I was pregnant. My baby was almost due, and I believe it was about a month for the baby to be born. And then Apolonio died. 15 days after I had my test done, he died. And then they say they would test the kids. I would cry. I would say, my kids are going to have it. What would I do if they were positive? All that illness, what am I going to do? And I went and they did the test on my kids. And the test came out negative. Before, my life was, well, I live happy. With no worries, I would not think that I was going to die. I would get sad. I am going to die. I would cry. With who are my kids going to stay? My mother is very old. She can't work or take care of my children. My life is changing now. Now I live cheerful, happy that I am on my treatment. I go walking to the hospital. I would have liked to tell Apolonio the things that I want, what my kids need or what I need, but it's not possible.
Señora, muy buenos días. ¿Es usted? Por favor, póngase. ¿Cuántos días tiene? ¿Se sienta, doctor, también, por favor?
Sometimes I look at the medication and say I don't want to take it. And then I think about it and say, I'm going to regret it. Who are my kids going to stay with? So I take it. But I do get frustrated. I would tell people that live with HIV to think positive. Don't get discouraged. You think that you are going to die. We think we are going to die. But if you take your medication, we will not die.
I was on a panel a few years ago with the editor of Lancet, and he was protesting our ideas on testing and saying that they were a violation of human rights. And I turned to him and I said, are you suggesting that we protect people's rights by sacrificing their lives? And he didn't say anything after that.
In Uganda, our first clinic was in a rural area because many of the rural communities are really suffering and don't have any services. So we started there in Masaka district. We had many parents come and more children. They're very handsome. Very handsome suits. Nice to see you. How are you? I'm fine. We decided to build a swing set and a playground right next to our clinic. They're much less afraid to come for treatment. They run and play on the swings, and then they get called in to see the doctor. So it's not such a frightening thing.
We have more children being treated than any of our sites in the world. And getting parents to bring their kids in to be seen is difficult for a variety of reasons. Seeing so many children being treated is also extremely gratifying.
I decided to bring him here for blood test. When I saw that he is HIV positive, I said, no, let me start to stay with him because I know how to care for him.
And the next time I see him, he's going to be a big, strong boy.
Yeah.
Thank you. And I'm really, really happy you brought him for testing and got on treatment today.
You're welcome.
It's good. And you two take care of each other.
Yeah.
We need to keep parents alive because more and more orphans are created every single day.
It's really shocking the world is turning its back on the war against AIDS and that funding is being reduced. And that's a terrible tragedy.
This is a grandmother, this is Livia, this is Mariam, this is Emmanuel. Emmanuel is the breadwinner for the home. Mariam is the one at whom we are looking after at Uganda Cares. She's on ARVs. She has been in the clinic since 2006. And Emmanuel is the one who brings Mariam to the clinic because the grandmother is not able to walk down to the clinic. It is very far. So their parents died. Their father died. He was looked after for so long in the Masaka hospital. And afterwards, he died. They tell us Mariam is not taking well her drugs because at times they have no food. So they cannot take food on empty stomach. Kaungezi D. Kumachane kaungezi. Mariam told me that to know her time, there is a bird that sings and she knows that it's time to take her medicines. The bird speaks early morning and in the evening. So afterwards it goes to its own nest. So it is in the morning and evening. That's when she knows that it's time for taking ARVs. Usually at the topmost there. That's where it is. It say that the bird says, it's in morning, it's morning, it's morning, it's evening, it's evening, it's evening, it's evening. I'm asking her what she would have wanted to do when she's mature like me. She wants to go to school. She wants to go to school to get knowledge.
I'm Dr. Penina Yutung. I'm the Africa Bureau Chief. Our model is targeting communities that have high rates. We've used that in market communities. We are using it also in the fishing communities. And fishing communities are mobile communities who go out in the night to do their fishing, and then in the morning they bring the fish to be sold. What we have noticed about the fishing communities is that they have a different culture compared to the other population. They more or less live for the moment. They have a saying that goes, if the lake does not kill me, then HIV/AIDS will kill me. They are a vulnerable population. More or less 9 out of every 10 individuals has HIV/AIDS. Most of them have small wooden canoe boats that they use. They don't have life jackets. They don't even have any lighting. So most of the times when the lake is quite turbulent and there are storms on the lake, a number of them have capsized and died. Most of them have seen their peers die, and so they know that it's only a matter of time before it's their turn. Fishermen, that's a big challenge. They're very similar to road truckers for us. The fisherman comes from one island and sells their fish on another island, so in between he has one wife or two wives in both islands. There are no services out in the community for these populations. For the few fishermen that we have had on treatment and care, we've seen that sometimes they will not come because they're out on the lake, they need to make money, and when they feel well, they don't see that they have to keep taking their medication. And that means they're not receiving treatment and care, and so they're either spreading HIV/AIDS, and they are also dying earlier than most of the general population.
I know that we have it within our power, our ability to control AIDS in the world today. The question is, do we have the will?